Statistics 2016 census revealed 49% of Australia's population were born overseas, with over 300 different languages spoken in Australian homes and a variety of diverse religions recorded. These results provide a detailed, accurate, and fascinating picture of Australia's diverse and vulnerable population. This outlines the crucial element of inclusive healthcare services to meet the physical, emotional, and psychological needs of all Australians, regardless of diversity. Inclusive healthcare can be defined as a sense of belonging, feeling respected, valued, and seen for who we are as individuals, and a level of supportive energy and commitment from leaders, colleagues, and others so that we collectively and individually can do our best work. The concept of inclusive practice aims to ensure healthcare practices are responsive to the needs of all people, based on the principles of fairness, respect, dignity, and trust, where patients are seen as a whole and cared for specifically to them and their needs. 1 in 5 people in Australia have a disability, and this proportion is expected to increase due to Australia's ageing population. Disability is a part of human diversity and is a major contribution to Australia's healthcare system. The Disability Services Act 2006 defines a disability as any contributing condition that restricts one's ability to participate in activities of daily living. Disability is further defined as intellectual, psychiatric, cognitive, neurological, sensory, or physical impairment, or a combination of all of these impairments, which is permanent or likely to be permanent. Disability results in a reduction of capacity in relation to communication, social interaction, learning or mobility. Therefore, majority of people living with a disability require support services.
Health literacy is an individual's knowledge, skills, and abilities to access, understand, and apply information to make effective decisions and choices about health. It covers a range of skills, behaviours, and activities, such as reading about what foods are required for healthy eating, the motivation to participate in sports and exercise, or the capacity to make an appointment at a clinic. Health literacy is important because it shapes people's health by influencing the decisions people make, such as how often to take medication, when to access healthcare services, and which services to access. Ultimately, health literacy shapes a person's health outcomes by supporting well-being across people's lives. It is important for healthcare providers because it affects the way that they manage their relationships with patients and deliver healthcare. Low individual health literacy is associated with higher use of health services, low levels of knowledge among consumers, and poorer health outcomes. Individuals with a disability are at risk of low health literacy for functional reasons, such as impaired vision, hearing, speaking, reading, writing, or intellectual impairment. The health, independence, and engagement of people with disabilities can vary depending on numerous factors, such as aspects of structural surroundings, availability of assistive technology and devices, transport, employment and income, and negative attitudes towards individuals with a disability. These barriers to inclusion have a direct impact on an individual's health. Acknowledging these differences enables the unique needs of individuals with a disability to be recognised and addressed equitably, therefore increasing inclusion and health outcomes.
Get the care you need.
One of the best ways for a doctor to really accommodate my needs is when they ask me questions and they don't make an assumption of what I can and can't do.
Being healthy and having a healthy relationship with provider goes both ways. So the provider has to be proactive in looking into my condition, but I also have to be doing the productivity where I need to look into, do the research for what provider I need and communicating my need to my provider.
In order to provide patients, potential those with intellectual disabilities have sufficient apprehension of health literacy in order to increase their independence and actively participate in health-related decisions based on their own treatment and management. For those impeded explicitly by physical disability, understanding health literacy is not an issue. For individuals with intellectual, cognitive, and other special needs, they severely lack health literacy, resulting in a plethora of issues that impact them from independently seeking care and living life to its fullest capacity. Around 50 and 90% of those with intellectual disabilities have significant communication issues. It is evident there is a major lack of rehabilitation services, access to mainstream healthcare services, and active involvement in matters involving these individuals, which results in poor health outcomes. Those in this vulnerable group face many issues comprehending and utilizing health literacy due to several barriers such as issues with memory, lack of attention, lack of communication skills, lack of ability, inappropriate and non-specific communication from physicians, lack of self-advocacy, lack of cognitive ability to comprehend knowledge around health, as well as family and carer education. There is vast amounts of research that reveals communication is one of the major issues people with disabilities have that impedes their ability to comprehend health literacy. More specifically, they have a reduced ability to communicate and understand speech, which is characterized as short, incomplete sentences, dysarthria, and altered schematics. For these reasons, it is critical caregivers and family members have high sensitivity, knowledge, and awareness around this topic, as they play a major role in assisting to make health-related decisions for intellectually disabled people. However, these people are not usually trained to deliver and provide health-related information in a comprehensible and responding manner. Each of these factors indicate those with intellectual disabilities are vulnerable in the sense that they are unable to support and make decisions independently, highlighting the dire and urgent need to actively include these people in learning about health literacy.
According to the International Council of Nurses Code of Ethics 2012, the role of the nurse encompasses a respect for human rights unlimited by considerations of disability and illness. The Australian Nursing and Midwifery Federation 2018 states that people with a disability have a right to be included within the community. Nurses provide care and assistance in order for this to happen. Nursing care must be person-centred and evidence-based to be effective. Knowledge of the capabilities and strengths of individuals and not just their inability to do something is crucial for nurses to encourage patients with disabilities. Communication is key to establishing therapeutic relationships and understanding individual situations. Knowledge of the individual's health literacy is crucial to meet patient health needs. Never talk down or patronisingly to disabled people. Maintain eye contact, whether they are an adult or a child. Ask the family or main caregiver how best to communicate with them. Use sign language, facial expressions and gestures. Write on paper, use a computer or mobile. Communicating patiently and compassionately improves the cognitive communication skills of the person with a disability, enabling opportunities for social inclusion. Feelings of fear, isolation, exclusion, loneliness, anxiety, and depression are prevented. According to the Nursing and Midwifery Board of Nursing Code of Conduct 2018, vulnerable and disadvantaged groups such as the disabled are at risk of physical harm and sexual exploitation. Mandatory reporting of such behaviours are the responsibility of nurses. Actively listening to patients' concerns assists nurses to provide safe, person-centred and quality professional nursing care.
The impact of exclusion and low health literacy goes as far as to limiting and becoming a barrier for a disabled person to having a therapeutic health outcomes. It is already established that health literacy is an important part of autonomy as it enables and empowers us to comprehend health information and access services in order to make and apply health decisions. While those with physical disability do not struggle with low health literacy, the lack of advanced health services and effective communication is what keeps those with intellectual disability in isolation with the society. Therefore, as nurses whose profession value is based on holistic care, respect, and dignity for all individuals, it is important to actively pursue and implement these principles for those with disability to achieve the desired health outcome. As a major part of health literacy is based on how one perceives information, nurses can be mindful to use effective communication such as gestures, facial expression, sign language, and technology to express information. On a concluding note, further research, awareness, and advocacy on health literacy and inclusion should be enforced for the disability community to have access to quality healthcare.